This slide presentation covers the HINTS exam, which is a trio of tests that is a very powerful bedside examination method that is more sensitive than an MRI to reveal the presence of a stroke. As I said, the HINTS exam is a trio of tests. The first of these tests is the head impulse test or the head thrust test. Head impulse test is something we've already covered in lab. The next test is spontaneous nystagmus. Again, you learned how to identify the presence of spontaneous nystagmus the other day in lab. And the third test is something new that you haven't heard about before, and this is known as the test of skew, or it's also known as the cover-uncover test. Important to remember that HINTS is an acronym that stands for head impulse, nystagmus, and test of skew. I'd like to tell you a little bit more and demonstrate the test of skew. A positive test here is strongly linked to the presence of a brain stem lesion. And I'm just going to show you this video. First, you ask the patient to stare at your nose. The next, you cover with your hand, not necessarily touching his face, cover the eye of one eye of the patient, and then remove your hand and look for any kind of deviation of one of their eyes. As you can see from this video, when the examiner places his hand over the patient's right eye and then removes it, there's a pronounced deviation and realignment of that right eye to fixate on the nose. And finally, as a review, here's HINTS interpretation. Now for the head impulse test, as we talked about previously in lab, if you have a positive head impulse test, this indicates the presence of a peripheral vestibular problem. Now, the presence of spontaneous nystagmus is pretty rare in the patient with peripheral issues. However, if the nystagmus beats to the right when you have the patient look to the right and then beats to the left or is direction changing, then that's very indicative of a central vestibular disorder. Or if the nystagmus is spontaneous and purely vertical, that's also indicative of a central disorder. And then finally, the test of skew, which I've just demonstrated to you, is highly indicative of a central vestibular problem, specifically a brainstem stroke. It's important to note that the HINTS test is not for every patient. The HINTS test is going to be most useful when the patient presents with persistent vertigo and they have any of these central signs. Then it's really important to go ahead and refer that patient for more diagnostic testing.